Hello everyone, I am Dr. Kameshwar Prasad. I am Emeritus Professor of Neurology at AIIMS New Delhi, where I worked for 40 years from 1980 to 2020 and now continue to teach and do research in collaboration with AIIMS. But for seeing patients, I am now fully attached to Fortis Hospital, Vasant Kunj, where I see patients and treat. Today I am going to talk about stroke. Now the word stroke is often talked about in the public when there is a cricket match. So you know that we talk about Tendulkar's stroke, or maybe Raina's stroke, which you always cheer if there is 6 runs at a time. But people also talk about heat stroke. But both these things are different. We are talking about stroke which involves brain, and it involves basically because the pipes or the blood vessels going to the brain, they get into a problem. Now, when we talk about pipes getting into a problem, you should recollect yourself what are the problems you find when you have water pipes in your home giving you problem. There are 2 types of problem I'm sure you see. Your pipes get blocked, or a pipe starts leaking and therefore water is flowing out. Exactly like that, the pipes which carry blood to the brain, they may get either blocked or they may start leaking so that blood comes out of that blood vessel. So the blockage type of stroke is called in medical language ischemic stroke, whereas leakage type of stroke is called hemorrhagic stroke, or also simply brain hemorrhage. So these are the 2 types of stroke which are the most common. There is a third called venous stroke. We are not talking about that. That's much less common than these 2 types of stroke. So the blockage type of stroke is something which we'll spend some more time on. The blockage type of stroke is the commonest one, and 65% to 70% of strokes are blockage type of stroke. So you can imagine if a blood vessel is supplying blood to some area and it gets blocked, either in the neck or maybe above the neck, then blood will not flow. So some area of the brain which did not get blood will get damaged. Now, to avoid that damage, either by natural process or by some method, that blockage has to be opened. Now, sometimes it opens automatically when the damage may be avoided completely, or sometimes we have to admit patients and do something to remove that blockage. Now, accordingly, this blockage type of stroke may be either temporary or transient, or it can be something which will take long time for recover. So the one which is transient, which recovers naturally and recovers within minutes or maybe mostly within an hour, and certainly within 24 hours, is called transient ischemic attack because it is transient. So it comes and goes. On the contrary, if the blockage remains as it is, or persist for a length of time which goes beyond few hours, then there is permanent damage to some of the cells of the brain. And that is what is going to take weeks and months to recover. And in fact, I should tell you that out of 100 patients of stroke, 1/3 may lose life. 1/3 may remain disabled though they survive. And 1/3 they recover fully. Now, given this scenario, I am sure you would like to prevent stroke. We will talk about prevention later, but one thing I must talk today is the warning attacks of blockage type of stroke. How do you recognize that somebody is at threat of getting stroke? Now, for that, remember one small acronym called B-FAST. B-E and FAST is F-A-S-T. If you remember this, you will probably remember what are the warning signs. What is B? B stands for balance. If suddenly somebody gets lack of balance in walking. I means vision, as you can imagine. One eye, let's say there is darkness of vision, or maybe there is complete haziness of vision which clears up in a few minutes time. Or sometimes both eyes, there is darkness, you can't see anything, then it recovers. So E for eye. F for face. So face may look as if it's not symmetrical. So one side of the angle of the mouth may be drooping, for example. And therefore, you can look at the mirror and see that there is something wrong with the face. A means arm. So arm gets weak. You can't use it or raise it, or you have difficulty in using it. Maybe there is lack of coordination. And S is for speech. So speech means you basically get slurring of speech or inability to speak. So any one of these may be warning symptom, and T means time to act. So if any one of these occur, if there is problem in balance, in vision, or face is asymmetrical, or arm is weak, or speech is slurred, then it is time to act. That is what be fast means. So if you remember this small word be fast, and then what is the meaning of each one of these, you will remember the warning symptoms of stroke. I call it warning because this may recover within minutes, as I told you. It is called transient ischemic attack. But this may be a harbinger for a major attack which may cause 1/2 paralysis. So recognize these warning symptoms. If anyone gets it, you should get the very next day or as early as possible, go to a doctor, particularly a neurologist, who will check and make sure, knows or tries to find out what is the cause of this transient ischemic attack or warning attack, and then gives you treatment so that you are able to prevent the major attack to a great extent. These are the main things which are going to be remembered as warning attacks of stroke or mini stroke. Thank you very much.